Dental implants are fast becoming the preferred option for tooth replacement. With new technology, the placement is less invasive than having a tooth removed. It is a great treatment option for patients to regain their smile or to help with everyday functions such as eating and talking. When a tooth is removed, a bone graft is normally placed to help build a solid foundation for the dental implant. If the tooth is already missing, we may have to place a graft and let it heal before placing the implant. Placement of the implant normally takes about 1 hour. After the implant is placed, recovery is quick. Patients do not have to miss any work time and can continue on with normal daily routines. 3 to 6 months after the implant is placed, patients have 2 more appointments. The first appointment is to take a measurement of the implant that was placed for the final crown. The second appointment is for delivery and completion. For those patients who may be missing all their teeth or currently using a denture or partial, implants can be used to support their denture to provide better stability and retention and give patients the option to have something permanently placed. Implants are the new method and standard of treatment that will change many smiles.